Hello, and welcome to Diversified Hearing Rehabilitation Balance. I'm Dr. Sal Gradoria. I'm the founder and CEO of Diversified. Over the next few minutes, you're going to hear a little bit about our history and about what motivates us to do what we do. After that, you'll hear a little bit about the services that we provide. So if you should have any questions at all, please stop by our reception desk. We'll be happy to help you. Or visit our website at www.diversifiedwny.com.
Dr. Sal's inspiration for starting Diversified came from his father's, Sal Gradoria Sr.'s experiences. Sal's senior journey with severe to profound hearing loss began during his service in the Navy during World War II. His ship, the USS Ticonderoga, was struck by kamikaze planes, causing extensive damage. While he was fortunate to survive, the noise from the explosions left him with permanent hearing loss. As time went on, his hearing challenges deepened, but with the help of hearing aids, he regained the ability to communicate and connect with the world. His struggles and triumphs were the driving force behind Dr. Sal's decision to become an audiologist and speech-language pathologist. With his father's struggles in mind, Diversified was founded with the dream of providing exceptional care in a compassionate, patient-focused environment. Today, patients confirm we have achieved that vision. Diversified has grown to 6 convenient office locations across Western New York, offering a wide range of services, including audiology and hearing aid services, dizziness and balance testing and rehabilitation, physical therapy, occupational therapy, speech-language therapy, voice therapy, swallowing therapy, and special education. Diversified specializes in treating both pediatric and adult patients, ensuring care tailored to every stage of life. As a privately owned clinic, we proudly operate differently than corporate healthcare providers. Our relaxed, family-like environment ensures that every patient receives personal care and attention. Our team of licensed professionals has the ability to treat each of our patients individually, so that you never feel that you are being pushed through the system like a herd of sheep. Old-fashioned quality care is back. The awards that we have received are a testament to the patient-centered service that we provide. Whether you or your loved one is experiencing hearing loss, physical challenges, speech or swallowing difficulties, our expert team is here to help. Our audiologists, speech-language pathologists, physical therapists, occupational therapists, and special education teachers are dedicated to providing solutions that improve quality of life. To learn more about how we can help or to schedule a consultation, visit one of our offices across Western New York, call 716-871-9883, or simply visit our website, diversifiedwny.com. At Diversified Hearing Rehabilitation Balance, we are known for our capabilities, chosen for our compassion.
Hey, have you been asking people around you to repeat what they say? Perhaps saying, huh, more often than you used to? Well, these are some of the signs that your hearing just may not be as great as it used to be. And here are some tips on how to maintain healthy hearing. And more importantly, how to maintain a healthy brain. Look, you might think that we hear with our ears, when in reality, we hear with our brain. And so it makes sense that hearing loss is a leading indicator of increased risk of developing dementia. Yikes! Look, we owe it to ourselves, our brains, and our loved ones to do whatever it takes to hear our best and keep dementia at bay. So, here are some tips for healthy hearing. Number 1, if you haven't done so already, get your hearing tested. Number 2, hearing loss, like all major medical conditions, actually, it's the third most common chronic medical condition that impacts older adults. It's really important that you catch it early and treat it early. That's right. Early treatment of hearing loss not only improves quality of life, but improves brain function and is indicated to be the number one thing you can do to reduce your risk of dementia. And once you've done the above, then you can also begin to focus on other ways to improve your hearing and communication with your loved ones by living your best life, feeding your brain healthy foods, exercise, meditation, and so much more. Thanks for tuning in and take care.
Hey there, amazing parents. Today, we're diving into something super important: early intervention. So, what exactly is early intervention? Simply put, it's a way to help young children, especially those who may have developmental delays or disabilities, reach their full potential. Imagine this. Your little one is growing up, but you notice they might need a bit of extra support. Early intervention steps in to provide that support through a range of services. Think speech therapy, physical therapy, and many other tailored services designed to meet your child's unique needs. The goal is to catch these needs early on and address them effectively. This could mean helping your child improve their speech, motor skills, or even social interactions. The earlier we start, the better the outcome for your child's development. But it's not just about the kids. Early intervention supports the whole family. It provides parents with the tools and strategies to help their children thrive. You'll have access to a team of professionals who are there to guide and support you every step of the way. Let's take a quick example. Say your baby is having trouble with motor skills. Early intervention might include physical therapy sessions where a specialist works with your child to improve their movement and coordination. These small steps can lead to big milestones. Remember, early intervention is not a one-size-fits-all approach. It's personalized to fit the specific needs of your child and family. And the best part? The sooner you start, the more effective it can be.
This is the single most common cause of vertigo, but that does not mean that it's an easy thing to tolerate when you're dealing with it. This is Earl the ear. He's a right ear, by the way, and we're going to show you what's going on. Now, when I'm looking straight ahead, my right ear is angled about here. My big floppy outer ear is out here, the long ear canal, an eardrum, which vibrates with sound, to hit some bones, which vibrates the cochlea. And this snail shell is where we actually hear things. And all that hearing information gets carried down this big nerve off to the brain. But you might notice, that's only half an ear. What about this other half? So this other half of Earl, this crazy maze here, is totally separate from your sense of hearing. This is my area, the vestibular system. This is where our balance awareness and orientation takes place 24 hours a day. These tubes here are full of fluid very similar to ocean water, and it moves whenever you do. I always think of a hula hoop full of water. If you were to turn, well, that water would move too. At each of these three dead ends, there's a little flap that acts as a sensor. Whenever you move, you can tell what direction and how much you've moved, and all that information can get sent down these nerves to the brain as well. Now, deep in this area, it's not really shown, it's inside of Earl, there's a bunch of crystals that make a bed and a wall. And what they do is, if you imagine a buoy in the ocean, it's got a long rope to the bottom. If you saw it moving one way or another, you would know which way the water is moving. And these crystals, that's their job too. If you hit the brakes in the car, or the plane takes off, or you stand up, you can feel momentum forward, backward, even sensing gravity with the wall of crystals. So, all of that information for your balance, for your orientation, gets sent down the vestibular nerve. All of the hearing information goes down the cochlear nerve, and then it combines into the vestibulocochlear nerve. Now with BPPV, the crystals are everything. The sheet of crystals in there, it's a lot like your skin. You make a layer, and then a new bottom layer, and the top layer flakes off, and a new bottom layer, and the top layer flakes off. But unlike skin, which can just flake away and make dust, where are these crystals going to go? This is inside your skull after all. Well, vitamin D3 plays an important role in holding those crystals down, or else they all might break off a little too early. Then they won't all dissolve like they're supposed to. If you have enough of these loose, undissolved crystals, you lay down and they might just wander into one of these tubes. Now, the sensor, which normally just feels the gentle brush of water, gets hit with a rock or just pushes way more water than normal, and the sensor triggers, so your brain interprets that you're turning and still turning and still turning and still turning. That spinning sensation, that's what we call vertigo. So, what are we going to do about it? Actually, it's pretty simple. Now you've met Earl. This is Erica. She's also a right ear. We need to get her crystals out of these tubes and let them dissolve like normal. And it's a lot like getting sand out of your shoe. I can't just shake the shoe and expect all the sand to get out. I have to move the whole thing in just such a way to get all of the debris, sand, crystals out of the single exit back where it should be. Then you can lay down, bend over, no more vertigo. It's done. But to get the crystals out, you have to move the crystals, which means you're going to have to go through some spinning to get rid of the spinning. That being said, there are definitely ways to make treatment much more tolerable. Personally and professionally, I strongly do recommend that you do not perform these maneuvers at home without a professional diagnosis and potentially them treating it first for a few reasons. Number one, there are 6 canals total, 3 on each ear, and each of them gets their own unique maneuvers. Number 2, to be successful at these maneuvers, you need to accurately orient your head relative to gravity, sometimes a little bit past neutral, while you're experiencing vertigo. Or else you'll move crystals, but they'll just go right back, so you trigger vertigo without improvement. Or, though it's not super common, you may actually get them to fall into another tube. So now 2 tubes have crystals, and the problem's even worse. Number 3, vertigo is only a symptom, but there's a lot of different causes, not just crystals. The maneuvers are the gold standard for the crystals, but it's not going to treat other diagnoses. So, first things first, get a proper diagnosis and have the professionals take care of it. That's your ENTs, your physical therapists. Find a vestibular provider, someone who treats this often. Have them take care of it, and don't worry about it after that. From my personal practice, I would say roughly 90% of the patients I see with BPPV are totally clear of vertigo within 1 visit, with 2 to 3 maneuvers each to get every bit of sand out of that shoe. The first round's the most intense, then a lot less, and then you repeat till nothing happens. Occasionally, someone does have crystals in multiple canals, maybe one canal on each side, or if there's another diagnosis at the same time, or for some patients who just may be a little more sensitive to nausea, you may need to have a second visit or 2 to really make sure that everything's clear. Once it's definitely clear though, you can go back to normal life basically right away. You might feel a little off for a day, like if you went on a roller coaster ride, but you should be able to lay down to sleep, tie your shoes, back to normal. If there's no crystals, there's nothing triggering the vertigo. So, I always tell people though, if there's still a little bit of spinning or dizziness while lying down, there might be a few rocks left in there, you come right back in. The good news, there are 2 big things that you can do to help prevent this from ever happening again. Number 1, vitamin D3. This is the big one. If you're deficient, the chances of those crystals getting loose and getting stuck in the tube again goes way up. While you're at the doctor, the ENT, you can have your blood tested, see if you have low vitamin D. Number 2, don't hit your head. That can certainly knock crystals loose, and often if it's from a head impact, it actually takes more maneuvers to get it done, and it tends to scatter into more than one. A last note about BPPV. Some patients are really scared to get into certain positions because they think it'll trigger again. They'll avoid yoga or tennis or golf or all these other recreational things. The thing is, most BPPV is just random. Vitamin D3 deficiency is certainly an impact, but so is age, osteoporosis, diabetes, hyperlipidemia has a big impact, whether or not you have a history of migraines. There's a lot of factors, and maybe you have none of those, but you still got BPPV. That's actually not terribly uncommon either. But going into positions like laying flat or downward dog in yoga, it won't cause BPPV, and avoiding them won't prevent it. Simply, it happens, get the treatment to get it better, and it is a benign paroxysmal positional vertigo. The benign part means it's not damaging anything. The ear is healthy and back to normal once it's out. So, don't be afraid to move and stay active.
Hearing loss is actually an important medical condition. It's not just an inconvenience, and it's not just humorous when you mishear and think someone said something different than what they actually intended. There's very clear data now, particularly in large studies, that show that untreated hearing loss is actually a risk factor for dementia and other cognitive disorders. And this makes sense if you think about it. The way most of us lose hearing is we tend to lose hearing at the high tones. High tones give us consonant sounds. Low tones give us vowel sounds. If you still hear the vowels but don't hear the consonants, you can't tell the difference between hat, bat, cat, and rat. Imagine a conversation when you mistook the word hat for rat. It could cause some confusion and maybe a little bit of excitement, and it could be a little bit funny for a while. But once this starts happening, people start getting a little bit confused in terms of what the conversation is about. The patient themselves may get frustrated, and worse yet, the family gets frustrated. At that point, it's not very hard to imagine that someone can become isolated or even depressed over this. Other things that hearing loss can cause, in addition to initiating this confusion and this isolation, it actually turns out that untreated hearing loss is a risk factor for falls and imbalance. And even though we don't work quite like bats that can use their listening to guide them around in the dark, we do rely on hearing to help us in terms of understanding the threats around. Many years ago, when people had hearing loss and didn't want to do anything about it and weren't interested in hearing aids or other devices to help them, we considered it an elective personal decision. Now, it's really a medical decision. Not treating hearing loss, particularly in the elderly, puts them at higher risk for cognitive decline, dementia, even isolation, depression, and even balance disorders. So we pretty strongly recommend that if you've got hearing loss, or you suspect an elderly person in your family has hearing loss, they should be evaluated and at least go through a trial and an evaluation of some of the treatment strategies that are now available.
As an audiologist, I work with patients with problems with both hearing and balance or vestibular problems. The vestibular system is located within the inner ear, and we're able to test it through a battery of tests. Testing may include the following: video nystagmography, or VNG. For VNG testing, a video camera attached to a pair of goggles is placed on your eyes. VNG testing has four main parts for recording your eyes. 1. The evaluation of quick eye movements. 2. Tracking moving visual targets. And 3. Recording eye responses to different head positions. And 4. A caloric test. During caloric testing, warm and cool air is gently placed into your ear canal to temporarily stimulate the inner ear balance system and record any eye movement. Sometimes this test can result in a slow rotating sensation, but it's very temporary. CVEP, or cervical vestibular evoked myogenic potentials. CVEP testing is used to determine whether the saccule, an inner ear organ, or inferior vestibular nerve are functioning properly. Electrodes are placed on the neck and sounds are transmitted through a pair of headphones. The electrical response of your neck muscle is recorded as you turn your head towards your shoulder. OVEP, or ocular vestibular evoked myogenic potentials, is a test to determine whether the utricle, an inner ear organ, or the superior portion of your vestibular nerve are functioning properly. Electrodes are attached to the eyes and sounds are transmitted through a pair of headphones. The electrical response of an eye muscle is recorded as you look upwards towards your forehead. VHIT, Video Head Impulse Test, is a clinical test of each semicircular canal of the inner ear. Ultra-lightweight goggles with a camera capable of measuring movements are placed on your head. Your audiologist will perform several head movements and collect data to determine the status of your vestibular system. Rotary chair testing. You'll be placed into a chair with goggles with a video camera on them. One rotary chair test is called SHA, or sinusoidal harmonic acceleration. SHA is a clinical test of the ear-to-eye reflex, or the vestibular ocular reflex, VOR. The chair gently moves from side to side at a calibrated speed as we watch what your eyes do. The final rotary chair test is velocity step testing. The chair will start to spin in one direction. After 1 minute, the chair stops spinning, and your eye response will be recorded. This test collects valuable information on the overall health of your vestibular system.
I'm a doctor of physical therapy who specializes in vestibular rehabilitation, which means that I treat patients with dizziness, imbalance, and vertigo 40 hours every week. Let's talk. Isn't it normal to be more off balance and dizzy as you get older? Well, let's talk about aging, balance, and dizziness. There are two big misconceptions here. One is that balance is worse simply because of getting older. And the more serious of the two, in my opinion, people will accept dizziness simply as a part of aging when they really shouldn't. Now, dizziness can be caused by many things. Some are actually more common in children. Some are more common, yes, as we get older, and some are really common middle-aged. But dizziness is never normal at any time in our lives. For a few examples, vestibular migraine is a diagnosis that's much more common in teenage years and the 20s. BPPV is much more common 60 plus. Perilymphatic fistulae really commonly is diagnosed when you're a child. And Meniere's disease, well, that's a middle-aged diagnosis. These examples show that age alone would not be the guilty culprit, but instead we need to look at the individual cause of the dizziness, which is related to age, but not just from having too many birthdays on board. Dizziness at older ages does have a more serious consequence, though, as something like a fall can be much more damaging. But that's why we really need to discuss balance as well, as the two are very linked. The inner ear is where movement and orientation are sensed. The nerve from the ear to the brain carries the information. The brain uses that information to tell your muscles what to do to keep you upright. Now, the brain and muscles do see decline with age, which is inevitable. However, balance and stability is a complex mesh of multiple senses, our experiences, our attention, the actual task at hand, and the muscles that make it all happen. So if we want less dizziness or greater stability, we can manipulate any of those in order to improve. A simple adjustment like glasses can improve one of our senses immediately. Practice gives us specific experience, and other exercises like resistance training improves our muscle strength and speed. While senses and muscles are a lifetime battle to care for over time, experience actually increases with aging. If we think of an ice skater spinning full speed, which is crazy, they're not born like that. They had to spin, get dizzy and fall over, spin, get dizzy, fall over again and again. But eventually, they don't get dizzy and they nail it. But their ears, eyes, muscles are not unique. Their brains had to learn over years of practice. I've treated many patients well into their 90s, and the big secret of balance is this. If you want to keep moving, keep moving. Most of the exercise routines that I give as a vestibular physical therapist, treating patients with dizziness and imbalance, are 5 to 10 minutes, more or less, depending on a patient's needs. Maybe they struggle getting up the stairs, playing pickleball, picking up grandkids. I've got a few folks that are really into jazzercise. But there is never an age where the brain and body are unable to improve. Never. As early in life as possible, though. Get exercising, get your muscles strong, and keep them strong. Build experience at balancing well. The great news is you are in control, taking charge of your own health. Another part of health to take charge of, especially for the older adults, is polypharmacy, as in too many drugs. A common issue, sadly, that can cause dizziness is when a person is taking too many medications at the same time. Dizziness is the single most common side effect of all drugs, and when a few medications combine, the chances go up even more. So, if dizziness, imbalance, or vertigo is a concern, don't blame age alone. Get control of it by visiting your doctor to manage those medications, an ENT for a potential inner ear diagnosis, and a physical therapist for treatment. Discuss your prescription drugs. Get tested for balanced performance. Get a diagnosis as to why you have dizziness or vertigo. Maybe it is from medications you no longer need. And get moving with your physical therapist to overcome these concerns. When it comes to exercise, if you don't have the time to be healthy, then you definitely don't have the time to be unhealthy. Take charge of your health. Find the help you need to get started. Thank you so very much for watching. And remember, dizziness, imbalance, and vertigo are never normal.
"74-year-old Donna Hart was once so afraid of falling that she stopped driving and doing simple chores. Donna's falling was due to balance issues, which began after a short hospital stay. Her neurologist recommended vestibular therapy, which is a form of physical therapy that uses specialized exercises to improve gaze and stabilization during walking.
Takes a look at all the aspects of balance. So it looks at the vision aspect, the vestibular aspect, which involves the inner ear, and it looks at the sensory aspect. So we determine in those three areas where is the problem, and that's how we determine what we're going to treat.
All right, we're going to do it again.
Okay.
You ready? We'll do it on the plate that's not moving one more time. All right, nice and controlled. Good job.
Donna's balance issues have to do with her inner ear. Her specially trained physical therapist developed a rehabilitation plan tailored just for her using the latest high-tech equipment.
One of the great benefits we have is we're allowed to do a lot of training. We have a great team that shares a lot of the interests, so we have some time to develop and bounce ideas off of people.
I started to be myself again after the first treatment. It was 98% effective. There just was no more dizzy unless...
We're gonna do side step walking on the foam because we've been working on strengthening our trunk muscles. Our trunk is our powerhouse, right? So we have to keep our trunk strong, which is gonna make our limbs strong. So when we walk on this foam here, we're gonna work on holding our belly muscles in to keep us strong, okay?
So who can benefit from vestibular therapy?
A big red flag for somebody that needs some vestibular therapy is someone that is falling or experiencing spinning or dizziness or feels like things are moving that aren't really moving around them.
And Donna is learning how to keep her world under control thanks to vestibular therapy, which typically lasts 6 to 12 weeks. Therapist Erin Weigel and her team love what they do because they see their patients, like Donna, getting better.
It's very rewarding to have somebody tell you that you've made a difference in their life.
How does that make you feel?
Wonderful.
The kids love to come here. They love to play. All the time parents are saying how excited they are to come to their appointment. They can't wait. They know the day of the week that they are supposed to come. Like, I see Miss Amy on Thursday morning. I can't wait. So that's always a good feeling, knowing that the kids want to come. Hi, my name is Amy Doyle, and I am the team lead occupational therapist at the Speech and Language Center. Occupational therapy is basically the practice of incorporating your occupations into your daily life. So people think about occupation as their job. Kind of. It's more so what keeps you busy, what things that you like, what is interesting to you. And so for kids, when we're thinking about occupations, we're thinking about play. So in occupational therapy, we are helping kids do the things that they need to do to be independent and supporting their families by playing. Sounds a little bit different, but it's what we do. I tell people when they bring their kids in, it's gonna look like we're playing games. It's gonna look like we are just sitting around playing. But really what we're doing is breaking down the activities that they're doing, looking at how they do it, looking at what is getting in the way of him being able to do something independently. Can he pick up the checker and put it on the board? Or is he having difficulty with his grasp? So we're gonna play the game so that I can kind of analyze what's going on with his fine motor skills, his gross motor skills, his motor planning. There's just so much that goes into it. So physical therapy is looking at what is limiting you physically, like muscles, joints, that kind of thing. And occupational therapy is looking at, okay, what is limiting you to do the thing that you need to do, and how can we help you be able to do it? The big phrase that people say is physical therapy will help you walk, occupational therapy will help you dance. The thing that I love about occupational therapy and what really drew me to it is the creativity that you get to put in every day. Just seeing the families who get to see every day something new that their kid learns or something new that their kid gets to do that they've never been able to do before. Seeing the joy on kids' faces when they do something that they've never been able to do before. It's the helping the families, helping the kids become more confident. I find it really rewarding to be a part of these families and getting to see these little moments of success and excitement that they have every day.
Do you have noises in your head? Today, I'm talking about 7 possible causes. Noise, buzzing, ringing in the ears, however you describe it, is called tinnitus. It's only a sound that you are hearing. It's not a sound that's naturally occurring in your environment. It may come or go, or be a constant sound that you hear. Tinnitus can occur in one ear or both ears. It may also sound like it's in your head. It's often more noticeable in quiet places. First, if you have tinnitus, make sure to ask your physician about it and then have a hearing evaluation by your local audiologist. Once a cause for the tinnitus is identified, your provider can make recommendations on how to best treat it. Okay, so here's some possible causes for noise or tinnitus that you hear. Sensorineural hearing loss. Sensorineural hearing loss is permanent damage to the hair cells inside the ear. This damage can cause tinnitus with people who have mild or greater sensorineural hearing loss. You may even experience tinnitus when your hearing test results are in a normal range. For adults, normal hearing test results are anywhere from -10 to 25 decibels. That's a wide range of normal, and if your hearing did get worse but is still considered normal range, it's possible that you could still have tinnitus. Noise exposure. Excessive noise can cause sensorineural hearing loss over time. You may even notice that your ears ring after a loud concert. If so, you want to make sure to avoid loud sound or wear hearing protection like earplugs or ear muffs. Your ears may ring right after a loud concert and then recover. However, if you have repeated exposure to loud sounds, you might notice that tinnitus returns and doesn't go away. Otosclerosis. This is an abnormal bone growth in the middle ear that causes conductive hearing loss. This restricts how sound transmits through the ear, so your tinnitus may be more noticeable. Eustachian tube dysfunction, ear infection, or fluid in the ear. The eustachian tube regulates the air pressure inside the middle ear. If this tube does not open and close normally, or if there's any other disruptions to the middle ear, like ear infection or fluid, this can negatively impact your hearing and you may notice tinnitus. An ear, nose, and throat doctor can treat this condition. Ototoxic medication. Any medication that's ototoxic means that it's toxic to the inner ear. This may cause sensorineural hearing loss and tinnitus. Make sure to ask your physician if you experience any tinnitus or hearing changes after taking medication. Muscle spasms in the middle ear. The middle ear is where the eardrum and ear bones are located, so any changes in the function of the middle ear can contribute to the sensation of tinnitus. TMJ, temporomandibular joint disorder. TMJ can cause pain in the joint connecting the jaw and skull. It can also be related to tinnitus. Consult with your physician or dentist for more guidance on this condition. Remember, if you have noises in your head or ears, go see a physician to rule out any medical cause. An audiologist can evaluate your hearing and determine if hearing loss exists. Your provider can assist you in treatment of the symptoms that you experience.
We focus on individuals and what they do in their everyday life. So whether there's disruption because of illness, whether there's disability, whether there's disease, or it could just be wellness, we make sure that our clients are doing the job of living. And occupational therapy focuses on activities of daily living. So that can be showering, dressing, cooking, cleaning. We also focus on what an individual's roles are. So it can be the role of getting back to being a mother, a student, a father. Whatever your job is, whatever your intentions is, whatever you find meaningful in life, that is what your therapist is going to work on to make sure that we are getting you back to those things that are meaningful to you.
Thank you for joining me today for an introduction to speech therapy, how it works, what it treats, and the role of a speech therapist. Let's start off by defining speech therapy. To put it simply, speech therapy helps people improve their communication abilities. It can benefit people of all ages, from very young toddlers to older adults. Speech therapy may address something as specific as improving a lisp, to something as expansive as relearning how to speak after a stroke. It all depends what conditions and related complications are present for the person receiving therapy. But no matter what, the goal is to enable people to express their needs and share their thoughts, ideas, and opinions with the world. Every person deserves to be heard, and speech therapists are here to help make that happen. Let's talk generally about the conditions that speech therapy treats. There are many areas of communication that can be addressed by a speech-language pathologist, commonly known as a speech therapist. Speech therapy treats issues surrounding speech, language, voice, and cognition, as well as oral motor and swallowing abilities. Speech refers to the ability to physically produce sounds. A child may come to therapy because of a speech delay, such as having problems saying sounds like or th. Speech issues can persist into adulthood if not treated during childhood. These might be lisps or other speech sound errors. Adults and children may also receive speech therapy to help with speech problems related to neurological diagnoses, such as stuttering or apraxia of speech. Issues with language means that a person has trouble communicating the message they want to say. These are generally broken out into two categories: receptive language disorders and expressive language disorders. A receptive language disorder refers to problems understanding spoken language. An expressive language disorder refers to issues communicating thoughts and ideas. Another type of condition that speech therapists treat is voice disorders. This refers to problems with the quality, volume, or pitch of a person's voice. Voice problems such as dysarthria, dysphonia, vocal fold issues, or polyps can cause many issues with how your voice sounds and feels. Gender-affirming voice training is another area of speech therapy. Speech therapists can help a person attain a voice that truly fits and aligns with their authentic self-identity. Many people don't realize that speech therapists treat problems related to cognition. When someone has a stroke or traumatic brain injury, their communication and executive functioning abilities can be impacted. Speech therapy can help them with daily tasks such as learning to read a calendar again, performing problem-solving and reasoning tasks, and improving memory. Speech therapists also help people who have feeding and swallowing difficulties. Therapists can make food and liquid recommendations if a person is having trouble swallowing safely. They can also help people learn to tolerate new textures and types of food if they're aversive to certain foods. We've talked a lot about what speech therapy treats, but what about the person providing it, the speech therapist? Speech-language pathologists, commonly referred to as speech therapists, are experts in human communication, its development, and related disorders. As we've discussed, they assess, diagnose, and treat a wide range of speech and language disorders, cognitive communication issues, and oral, swallowing, and feeding issues. All certified speech-language pathologists have at least a master's degree and are licensed in each of the states they practice. They are certified by the American Speech-Language Hearing Association and are required to pass a national exam and complete a supervised clinical fellowship. You can also view a speech therapist as something of a coach. Think of how an athletic coach helps their players improve in their sport. That's exactly what a speech therapist does. They provide unique treatment plans, techniques, and support to teach people the skills they need to communicate as clearly as possible. If you have questions or need guidance related to a communication problem, know that you are not alone. There are many qualified professionals ready to help you. It's what we speech therapists have dedicated our lives to. Everyone deserves the gift of being a confident communicator, and a trained speech therapist can help you become just that.